This is exactly what happened to Martha, 68 years old, a retired teacher living alone in Arizona. She had recurring yeast infections and bladder problems that just wouldn't go away. She tried creams, pills, even gave up coffee, but nothing worked. The itching and discomfort kept coming back. She figured it was just part of getting older. But during a routine checkup, her nurse leaned in and said quietly, "You're doing everything right, Martha, but it might be your underwear that's making you sick. Before you dismiss it, listen carefully. Have you ever stepped out of the shower feeling fresh and clean, but by midday, something just felt off? Maybe it's itching, maybe it's odor, or maybe it's just a strange discomfort you can't explain. If you're a woman over 60, the answer might be hiding in plain sight, right in your top drawer, your underwear. It may sound surprising, but doctors from places like Mayo Clinic and Johns Hopkins are warning. Certain types of underwear are directly linked to infections, chronic irritation, even bladder issues in older women. In fact, studies show that more than 60% of older women wear the wrong kind, without even realizing it. And here's the scary part. Most women have no idea they're making this mistake until it becomes a real health problem. So today, I'm going to reveal the 4 types of underwear that could be doing more harm than good. And at the end, I'll share the one fabric doctors now recommend for better comfort, fewer infections, and real peace of mind. It's simple, it's affordable, and chances are it's not what you're wearing now. If you've ever dealt with irritation, discomfort, or mystery infections down there, drop a quick "been there" in the comments so we know we're not alone. Let's talk about what's really going on, and most importantly, how to fix it. Part 1. The synthetic trap. Why polyester and nylon can be dangerous. Let's start with the one most women never even question. Synthetic underwear. They feel nice. They look flattering. They're everywhere. Easy to find, affordable, and smooth under clothes. That's why so many of us buy them without thinking twice. But behind the comfort, there's a hidden danger that most women never see coming. We're talking about polyester, nylon, rayon, and those stretchy blends with spandex. Let's go back to Martha. Most of her underwear was nylon. She loved how they felt. Soft, seamless, invisible under clothes. They looked good. They felt modern. But after months of non-stop discomfort, her nurse said something that stopped her cold. "Martha, your underwear might be making things worse." Why? Because synthetic fabrics trap moisture. Think of it like wrapping damp skin in plastic wrap. The heat and sweat have nowhere to go, and that creates a little sauna for bacteria. And here's the kicker. After menopause, the skin down there becomes thinner, drier, and more fragile. The natural protection you used to have, it's not the same. Every step you take in synthetic fabric adds friction, like walking in shoes that look nice, but rub you raw after an hour. And over time, that leads to tiny micro tears, which leads to irritation, which opens the door to infections. According to Dr. Andrea Singer, a leading gynecologist, synthetic underwear can worsen vaginal dryness and irritation, especially in postmenopausal women. For Martha, the fix was simple. She replaced all her nylon pairs with breathable cotton, and within just 3 weeks, the itching, burning, and infections were gone. She could finally sleep move, and live without that constant nagging discomfort. So here's your takeaway. If you're still wearing synthetic blends, especially ones that feel tight, warm, or too smooth, it's time to let them go. Not for fashion, for your health. Your skin has changed. Your body has changed. And your underwear should change too. Now that we've seen how synthetic fabrics trap trouble, let's move on to something even trickier. The one that looks the prettiest, but might hurt the most. And in part 2, we'll talk about something millions of women wear to feel sexy or elegant. But doctors say it might be doing more harm than good. Part 2. Lace. Pretty but problematics. Lace is the one we save for special moments. But those moments might be costing us more than we think. For many women, lace underwear feels like a small act of beauty. A quiet way to still feel like yourself. But here's the hard truth. Lace may look lovely, but for aging skin, it's often a silent source of pain. Just ask Martha. She wore a lace pair to her granddaughter's piano recital. She sat, stood, smiled, clapped. Just a normal evening. But by the next morning, she felt sore. By day 3, she had a rash that wouldn't go away, and it took over a week to heal. Why? Because lace isn't just rough. It's also usually synthetic. Most lace today isn't made from silk or cotton. It's made from polyester or nylon, just in a fancy pattern. That means it traps moisture, holds heat, and doesn't breathe. And it doesn't move well with your body. It's stiff. It shifts. It rubs. Every movement creates tiny friction points, like rubbing dry tissue paper across skin that's already fragile. And that's not all. Lace is often chemically treated, stiffened, and dyed using resins and fixatives. That can trigger irritation, discharge, or allergic reactions, especially when worn for hours. Dr. Felice Gersh puts it simply. Lace is a common cause of contact dermatitis in older women, especially when worn for long hours. For Martha, one bad night was all it took. She tossed every lace pair she owned and switched to soft, breathable cotton, pieces that still looked beautiful, but didn't leave her skin damaged. Because femininity isn't found in pain. It's found in how you feel. And underwear? It shouldn't feel like a risk. It should feel like self-care. So, if there's lace in your drawer, even the special ones, do yourself a favor. Toss them today. Your body will thank you. Lace may rub your skin raw, but sometimes the real damage isn't in what you see. It's in the silent pressure you don't notice until it's too late. And in part 3, we'll look at the most overlooked mistake of all, the underwear that still feels familiar, but no longer fits your body, and how it might be quietly putting pressure on your bladder, your skin, and your spine every single day. Part 3. Tight, ill-fitting underwear, the silent strangler. They still fit, technically. But does your body still feel okay wearing them? They roll down. They leave deep marks on your skin. They make you tug, adjust, and shift every time you sit. They've been in your drawer for years. They still stretch. They still technically fit. But your body isn't the same, and neither is your skin. Martha learned this the hard way. After switching to cotton, her infections cleared up, but the red lines and sore spots stayed. She blamed everything, except the real cause. Until her physical therapist looked at her waistline and said, "It might be putting more pressure than your skin can handle now." That's when it clicked. As we age, our skin gets thinner. Our weight redistributes, and that secure fit becomes something else. Pressure, friction, heat, all of it adding up to rashes, fungal infections, and even posture problems. Tight elastic doesn't just irritate your skin, it can press against your bladder, worsening urgency and leakage. And it alters the way you move. Dr. Lauren Stryker explains, women shift how they sit or walk just to avoid pain from tight waistbands. That can lead to hip tension, poor alignment, and back pain. Think about it. How often do you adjust your waistband or shift in your seat just to get comfortable? Now, imagine your body doing that subconsciously every single day. For Martha, the solution was simple. She replaced all her old binding pairs with soft, non-binding cotton. Within a week, the red marks were gone. Her back pain eased. Her skin could finally breathe. She said, "It felt like my body had room to move again. I didn't even realize how restricted I'd been until I stopped." So, here's your moment. If your underwear leaves marks, digs into your waist, or makes you constantly adjust, it's not supporting you. It's silently hurting you. Take one honest look today. Not at the tag, not at the brand, but at the way your skin feels after you take them off. Because your underwear should fit you now, not who you were 10 years ago. If tight underwear is quietly pressing on your body every day, then shapewear is doing it louder and for longer. Let's talk about the one we wear to look our best. That might be hurting us the most. Part 4. Shapewear and control underwear. Pretty, but at what cost? You put it on to feel confident, but deep down, you can't wait to take it off. Let's talk about shapewear, control underwear, tummy slimming panties, the ones we save for weddings, church, family photos, or worse, the ones we wear every single day. Let's go back to Martha. She wore shapewear to every event, and every time she smiled on the outside, but suffered on the inside. One day, after weeks of bloating and abdominal pain, her doctor asked, "Do you wear shapewear often?" That's when the truth hit. Shapewear doesn't just smooth fat. It compresses organs, reduces blood flow, overheats your skin, and weakens your pelvic muscles over time. Dr. Sherry Ross puts it simply, long-term shapewear use can weaken the core and pelvic floor. It forces your body to fight back. Imagine wrapping your midsection in shrink wrap. Your organs press outward. The shapewear pushes back, and your body is caught in the middle. The result? On the inside, acid reflux, bloating, urinary urgency, weakening of pelvic muscles, even early organ prolapse. On the outside, ingrown hairs, skin rashes, chronic irritation, cysts in the groin area. Martha had them all, but she never made the connection until she stopped. And within weeks, the pain eased, the bloating vanished. She could sit, eat, and breathe freely again. And the best part? No one noticed the difference in how she looked, only in how she felt. She said, "I finally felt like myself again. Not performing, not pretending, just present." So here's the truth. If your underwear is shaping you more than supporting you, it's not serving you. It's stifling you. And if you wear control underwear daily, not just for special occasions, the long-term damage can be even more serious. You've earned every wrinkle, every curve, every breath. Your body doesn't need to be squeezed. It needs to be honored. Confidence isn't about pain. It's about presence. And presence begins with comfort. So, take one honest look in your drawer tonight. If it digs, squeezes, or leaves you breathless, let it go. Your organs, your spine, and your spirit will thank you. So we've seen how 4 types of underwear, all common, all familiar, can quietly cause discomfort, infection, and even long-term harm. But the good news? There's one simple change you can make, starting today. Let's wrap this up with what really matters. Closing. The quiet revolution in your top drawer. The quiet revolution in your top drawer. You don't need to change everything, just your top drawer. That's where the quiet revolution begins. Let's take a breath and a quick recap. Part 1. Synthetics. Polyester, nylon. Trap moisture. Feed infection. Part 2. Lace. Pretty but stiff, synthetic, and chemically treated. Part 3. Tight fits that dig, rub, and silently distort posture and circulation. Part 4. Shapewear. Confidence on the outside, compression on the inside. We've worn them for years, and no one told us differently until now. This isn't about shame, it's about awareness. It's about honoring the body that's carried you through decades and still deserves kindness. Because underwear isn't just about fashion anymore. It's about function and health and freedom. The solution? Simple. Doctors now recommend soft, breathable underwear made from 100% cotton or bamboo fiber. Gentle, antibacterial, no tight bands, no friction, no drama. You've adapted for everyone else for years. Maybe now, your underwear should adapt to you. So here's your advice for older people. Go to your drawer. Give it 5 minutes. If it digs, traps, rolls, or squeezes, it's out. Because you deserve better. If this video gave you even one helpful moment, hit the like button, subscribe, share it with a friend who needs it. And if you've ever faced irritation, discomfort, or just felt like something's off, drop a "been there" in the comments. You're not alone, and your story might help someone else. Until next time, take care of yourself. Because comfort isn't a luxury. At our age, it's a right. And remember, you're not fragile. You're wise. And you've earned the right to feel good every single day. Coming up next, what you wear to bed after 60 might be the reason you're still waking up at 3 a.m.